What am I going to do about this buffalo hump? It's a question that I get every day when I'm in the office, and frequently even out in the community in social situations, individuals will ask me about their hump. Frequently it is a mother who's concerned that their daughter is developing a hump. Typically it's going to be females between 18 to 25 or 50 plus. An interesting fact is that most of those individuals that stop me and ask about this typically have minimal deformities. It's almost as if they have seen somebody with a horrible looking hump and now they're afraid they're going to develop one. In the case of the mother, I always assume that she has a best friend whose daughter looks like a buffalo. As far as buffalo humps, they come from 3 different common causes. One is an abnormal fat accumulation, and it's where the body deposits fat abnormally in that area. The abnormal deposit of fat is called lipodystrophy. The bump can be a bony abnormality. There can be a deformity of the bones at the base of the spine, and this will cause a hump in that area. Don't confuse that with a dowager hump, which is in the lower thoracic spine. This is a buffalo hump. Number 3, cysts and tumors can occur in that area, producing a hump as well. Fat accumulation can come from various different causes, including medications such as glucocorticosteroids, like prednisone, which is used to treat COPD, asthma, autoimmune diseases, lupus, rheumatoid arthritis. In certain situations, the body can overproduce glucocorticosteroids in conditions or diseases such as Cushing's syndrome, or if you have a tumor on your adrenal gland. Also, certain lung tumors and other processes can produce glucocorticosteroids. Abnormal bones can come from a congenital abnormality. The individual may have been born with a prominence in that area. Schiermann's kyphosis is an autosomal dominant condition that runs in families, producing kyphosis. Typically it is around T7, which is between the shoulder blades, but it can produce a buffalo hump under certain situations. Certain diseases and syndromes, such as ankylosing spondylitis, trauma, such as fractures or dislocations of the spine, can produce kyphotic angulations. Osteoporosis, as the bones wedge, can produce a prominence. Poor posture can, over the course of time, produce a fixed bony abnormality. But the most common cause of a buffalo hump is poor posture, poor lifestyle choices, and genetics. Treatment. If you have an abnormally large accumulation of fat at the base of the cervical spine, you should see your primary care doctor and have a complete physical and evaluation. They will review your medications and also run laboratory studies to check your cortisol levels. They can correct the underlying abnormality, especially if it's medication, and they can send you to the appropriate specialist if necessary. Your specialist will order the appropriate studies to determine if it's due to fat, bone, or some other abnormality such as a cyst or a tumor. In most cases, we're going to discover that it has to do with fat from posture, poor lifestyle choices such as eating too much and not exercising, and genetics. The first thing to do is modify your diet. The second thing to do is exercise, hopefully under the care of a licensed physical therapist or a doctor of chiropractic medicine, and they're going to work on posture. Under certain situations, surgery may be indicated. If they find a cyst or a tumor, you're going to need surgical excision. If you've undergone extensive conservative treatment, you've modified your diet, you've exercised, and you still have fat in that area, then you can consult a plastic or a cosmetic surgeon who can do surgical procedures, many of them minimally invasive, to remove the fat from that area. One example is a liposuction. If the bony abnormality is due to a compression fracture from osteoporosis, it can be treated with a kyphoplasty if it is caught early. In certain situations, if there is a bony prominence, that bony prominence can be shaved off. In most cases, this is probably not a good idea because the structures, ligaments and tendons that stabilize the cervical spine also arise from those bony prominences, and if you remove the bony prominences, you will weaken the neck, leading to a worse deformity in the future. Fixed bony deformities can be treated with what's known as an osteotomy. This is where the surgeon cuts the bone, straightens the bone out, and then holds it in place with rods and screws. This is risky and rarely indicated. I hope you found this informative. If you have any other questions or concerns, please write to me at Dr. Smith, elpasospinecenter.com. But the most important thing, give us a thumbs up and subscribe. Tell your friends and neighbors to watch. Share this video. We put a lot of time into it. Thank you for watching.